Fine, guys. Okay, so let me begin with speaking assessment criteria. It's writing. Let me start with this. So let's talk about the structure of the test first. How do they conduct, or what are you going to face on the test day, right? So as we know that there would be approximately 18 to 20 minutes of session, right? Initially, there is a session, we call it warm up, right? Which is for approximately 2 to 3 minutes. Now, what is warm up session? They can ask you general questions, for example, about your profession, right? About the experience that you have, why you chose nursing, all right? Any day which you remember in the hospital, or which was your best day while working, right? So they can ask you certain questions regarding your profession, or maybe according to your personality, they can ask you. Now, this particular session will not be assessed, right? It's just for relaxation or to make it familiar with, so that when you have session with the interlocutor is the person who would be there, a kind of facilitator from the OET officials, or we call it examiner as well. So examiners, we call it interlocutor, right? So with the interlocutor, you can listen to his voice, right? You can see his expressions, his pitch. You can understand it better. And when you have session, it would help them, right? Now after warm up session, then we get a role play card, your first role play card, right? Now you get your first role play card. And for role play card number 1, you get 3 minutes for preparation, right? So in 3 minutes time, you will have a role play card where you need to go through from it thoroughly with the help of pen or pencil. Even you can mark anything, you can underline, you can circle, you can make notes on your role play card, right? In 3 minutes time. Now, in case if you have any queries regarding pronunciation or maybe meaning of any word, vocabulary, even you can ask the interlocutor about pronunciation or meaning of the word, right? But in 3 minutes time. Now, sometimes you may get known cases like known patient's role play card. So where it's a known patient is in the ward, right? And you know the patient maybe very well or maybe well. In those cases, you can even ask name of the patient before your conversation. So in 3 minutes time, we can even ask name of the patient from the interlocutor. After 3 minutes, then you get 5 minutes for conversation. Conversation, you get 5 minutes, right? So role play card number 1, where you have 3 minutes of preparation, then you need to start a conversation with the interlocutor for 5 minutes, at least for 5 minutes. Now, in that 5 minutes, you will play role of the nurse always, and the interlocutor will play role of the patient always. Okay. The whole conversation will be recorded in audio files, and then they share these files with the OET office for assessment. After 5 minutes of your first conversation, then they give you second role play card. Again, you get 3 minutes for preparation and then 5 minutes of conversation. On the test day, you will get 2 role play cards. Okay. For each role play card, you will get 3 minutes of preparation and then 5 minutes of conversation that you need to make. Fine. So it's about 18 to 20 minutes of test approximately. Right. Any concerns till this point? Yes, Amrita.
So can I? Yes.
Please, please.
Like total, we will have 2 role play cards. Yes, sir.
Right.
And the first one will be having 3 minutes for the preparation and the rest 5 minutes for the conversation.
Right.
Same thing with the second role or same thing, sir?
Same, right.
Same
3
thing.
minutes
Like
of
the
preparation.
interlocutor will play the role of a patient,
Always.
and we must play the role of a nurse.
Yes, exactly.
Okay, sir.
Yes, Sadiq.
Yes, sir.
Any queries till this point?
No, sir.
Fine. Fine, guys. Shall we move next to the next point?
Yes, sir.
Great. Now, let's talk about the assessment criteria. So your 5 minutes of conversation would be assessed on certain parameters. Now, what are the parameters? Let's talk about this. So the assessment criteria is divided into 2 parts. Number 1, we call it linguistic criteria. Okay. Number 2, we call it clinical communication criteria. Now it's also called communication criteria or communicative criteria, right? So documented, we can say clinical communication criteria, right? So it's divided into 2 parts: linguistic criteria and clinical communication criteria. Number 1, linguistic criteria. Here we have 4 parameters, right? So there are intelligibility, next is fluency, then we have appropriateness of language, and then we can say resources of grammar and expression. Fine. Now we'll discuss one by one. Okay, first of all, intelligibility. Yes, Sonia, would you like to add anything here?
Sir, in this, accent should be very clear.
Excuse me, sorry.
Sir, in this intelligibility, pronunciation and action should be very clear to the patient.
Okay, fine. Fine,
Yes.
guys. Now, intelligibility. It's all about your linguistic part, right? So it beautifies the language, actually. Your voice, right? Your accent, your pronunciation, right? Now, it's basically about the pronunciation part, right? Pronunciation which can be easily be understood by the patient. Okay. It means we have to accept global or standard pronunciation, okay, or authentic. There are also some points like stress, intonation, and rhythm, right? We can take it as syllable stress, or maybe word stress. Syllable stress means, suppose if I give you one example, If I write this word, I hope it's visible, right?
Yes.
Make it. No. Fine. So I write a word, content. How do you pronounce this? Siddiq,
Content.
Sonia.
Content.
Yes, Amrita.
Content.
Okay. What is the meaning of this, Amrita?
Content is it consists the whole summary we call of the main topic, I guess.
Okay. Siddiq.
Content is something which will describe the complete summary. I mean, like
Fine. You mean to say subject matter, whatever is included,
subject matter. Right.
Subject
Right.
matter, call it.
Yes.
Okay. Now, guys, there is an interesting fact behind the pronunciation of this particular word. Now, suppose if I break this here, it's CON then slash TENT. Now, if I say CONTENT, now this is called syllable breakup. If I break a word into different syllables, so there are certain rules of breaking syllables. We'll get into this part a bit later. We'll just understand the overview, what exactly we are talking about. Now, if I break this word into two halves or maybe into syllables, if I put stress on my first syllable, for example, if I say CON slash TENT, if I'm putting stress on the first syllable, it's content, 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 content. Say it. Repeat.
Content.
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 So stress should be on the first syllable. Content.
Content.
Just small, like low voice. Content. Content. Content.
Content.
Try again.
Content.
Exactly. Now, next. If I put stress on the second syllable, then it would be content. 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 Say this.
Content.
Okay, one by one. Siddiq.
Content.
Content. Content.
Content.
Good. Monica, Sonia.
Content.
Once again.
Content.
No. Content. Content.
Content. Content. Content.
Good. Here's Amrita. Once again, please.
Content. Content.
Say content.
Content. Content.
Good.
Content.
Now we got two pronunciation. Content and content. Content, content. Content and content. Now, guys, here we get the deal. Both are different, with different meaning. If I say content, it means subject matter, right? But if I'm saying content of my books, content of the OET test, content of nursing, content of my bag, right? But if I'm saying content means, anyone? Content means satisfaction, happiness. I'm content with my job. I'm content with my work. I'm content with what I'm doing. I'm content with my friends. It's satisfaction, right? So here is the deal, how we use it. Now, if I say I'm content with my job, is it correct?
No.
No, it's incorrect. If I say the content of my books,
Wrong.
that is incorrect. content with my books. Yes, it's correct.
Yes.
But content of my books, then it's incorrect. Now, this is the deal, guys. How do we understand stress, right? Pronunciation, right? Next. So we go quickly to the next topic. For the next subtopic here, in intelligibility. So we can focus on word stress as well. Word stress. In a sentence, we can put stress on different words to convey sense. For example, if I say, this is my pen, just listen to my voice. Try to understand it, right? Try to get the sense. This is my pen. This is my pen. This is my pen. Now, let's understand this. This is my pen. I'm putting stress on this. Right? Means I'm talking about this particular pen. There are other pens as well, but I'm talking about this particular pen, that this is my pen. Right? I say, this is my pen. So I'm putting stress on my. This is my pen. So I'm saying, this is mine. It's not yours. It's mine. Right? This is my pen. So it's pen. It's not pencil. It's not marker. It's pen. So we convey sense with putting stress on different words in a sentence. We also call it voice modulation. So we'll be having different classes for this, right? And we'll be focusing on this if required, if needed. Now, guys, another thing, if your accent is different, it won't affect the score of intelligibility criteria. OET accepts accent from different parts of the world. So suppose if I'm Punjabi and I have a different accent, right? And you're from South, suppose, people are from, other countries. So they have different accent. Different accent is acceptable, but pronunciation should be correct. You shouldn't use incorrect pronunciation. Clear? So sometimes people call it pronunciation. So that's again correct. Pronunciation is incorrect sometimes. I hope you're getting this. Anyways, it's a kind of. So it's intelligibility where we need to focus on our pronunciation, maybe stress, maybe word stress, syllable stress. Yes, I hope it's clear till this point. Any queries?
No, sir.
Yes.
Great. Now, quickly, let's move to the next point. We have fluency. Fluency, you know this, right? How fast you speak. We also call it rate of speech or pace of speech, right? So how many words per minute? But there is specific, word limit for different English, even British or US, American English. But what exactly we focus in fluency? You should not use unnecessary pauses, fillers, unnecessary, right? It should be logical if you're using it. If you're doing pauses, it should be logical. Plus, it shouldn't be too fast to understand. My name is Gurvinder Singh Gill. My name is Gurvinder Singh Gill. So, according to the situation in a conversation, you can have different pace of speech at every step. For example, when you're asking questions, you may have different rate of speech. For example, if I ask you, Sonia, can you tell me at what time you wake up?
At what time I wake?
Yes.
Okay, I work in the morning.
Okay, fine. So if I ask questions, I can go a bit faster. Can you tell me at what time you wake up? But when I'm explaining, right, when I'm explaining things, when I'm suggesting, when I'm advising, I should go a bit slower, right? So that's the way in a conversation, you can have different rate of speech at every step. We will be focusing on this particular part in our regular sessions. Fine. Next. So we have appropriateness of language. So appropriateness of language Suppose if I'm telling this to my patient that, well, Mr. Johnson, you had MI last night, right? And Mr. Johnson just knows about, he knows about Redmi or MI phone. He doesn't know much about medical terminologies. What is MI talking about, right? So he would be understanding something else. So better not to use heavy medical terminologies, right? We can go for like simple terminologies, simple explanations, so that a layman, even a layman, can understand. So I can say you had a heart attack last night, right? Or you have been recovering from a heart attack, not from MI. In some cases, if I have to add medical terminologies which are not easily understood by a layman, even I can use it, but then I need to explain it as well, right? So suppose if I use a kind of term like migraine, suppose they don't know much about migraine, then I can ask this question. So do you have any prior knowledge regarding migraine? Right? Or my probable diagnosis is migraine. Mr. Johnson, can you tell me if you have any prior knowledge regarding this? He says no. Then I can say that fine, don't worry. Let me explain this to you. Let me guide you. Okay. Another thing, in appropriate language, if you talk to a 7-year-old boy and 70-year-old man, you would have different tone with them, right? You would have different word choices. So just focus on the appropriateness of language. Next, we have resources of grammar and expression. So grammatical structure, how do you use it? Right? How frequently you can change tenses, how comfortable you are with your grammatical structure, right? Vocabulary and wide range of grammar, right? So this is like all about grammatical skills that you use while conversing. Fine. So it's all about linguistic criteria. Yeah. All these 4 subtopics got 6 marks each, right? Total 6 into 4, 24.
Yeah, 24.
Wow, finally. So guys, be prepared. We are going to check your mathematical skills as well, your calculations. Warned. Okay, so in linguistic criteria, we have 4 subtopics. Number 1, intelligibility. Next, fluency. Number 3, appropriateness of language. Number 4, resources of grammar and expression. Right? 6 marks each, total 24 marks from linguistic criteria. Fine, guys. Any concerns till this point? If you have any questions.
No,
Yes, Amrita.
no, sir.
Yes, Siddiq.
Yes, sir. Just I wanted to know the last column. I was like, I want a little explanation about that last column, which was I can't able to see that. Besides appropriate, I think so.
Are you talking about the 4th one, resources of grammar and expression?
Yes.
Okay,
Yes,
okay,
yes.
fine. Now, it's all about your grammatical skills, how you use grammar while conversing in your conversation, right? Which tenses you're using exactly. So suppose if I underwent a surgery, maybe today or early morning maybe. So how are you using it? How are you using sentences to make like you were, or you underwent, right? Or you have undergone, right? Or you have been recovering from. So that's a kind of flexibility that you can use. So if I say that you have been recovering from elective knee surgery, that makes sense, right? Because it was done maybe early morning, this morning, and then he has been recovering from it. Means that's a kind of sense. Even if I say that you underwent, so if it's like older way, like 2 days or maybe 6 days ago, he was hospitalized for 6 days, and 6 days ago he underwent, then I can use this particular term, grammatical stuff. So that's all about your grammatical skills, how you use it.
Thank you, sir.
Even if I say that I have been smoking from last 25 years, right? And you say that you smoked for 25 years. So if I say that you smoked for 25 years, yes, he smoked for 25 years. But after that, after 25 years, then what? Is he still smoking? Yes. Then you have been smoking for last 25 years.
25
It started
years,
in the
that's right.
past, it's still continuing, and maybe continuing in the future as well. So that's the way how you use grammatical skills.
Yes.
Fine. Yes. What else, Siddiq? Any other queries?
No, sir. Thank you.
Yes, Sonia, Amrita.
No, sir.
No, sir.
Fine, great. Fine, guys. So I need to wind up this session for this particular part, and we'll join again in 5 minutes, right, for next specific topic. Fine.
Okay, sir.
Yes.
Fine. They will share links, and we can resume our session. All right, guys. Thank you so much. See you again.